Possibly falling on deaf ears, it's the Medicare for the Lazy Man podcast. The podcast whose magic 8-ball always says, ask again later. He takes a half hour to cook minute rice. It's Medicare expert Doug Jones.
Hello, ladies and gentlemen. We are beginning another exciting episode of the Medicare for the Lazy Man podcast, inspired by, based on the book Medicare for the Lazy Man, Simplest and Easiest Guide Ever. As I say in every episode, the 2022 version is out for your perusal at Amazon.com and BarnesandNoble.com. And you can have that thing in any number of editions. You can have the Kindle edition. You can have the Audible edition, wherein I read the book to you. You may have the hardcover version or the softcover. Right now, the softcover version, the paperback, has been running away. The sales for the paperback far exceed all of the other types of editions. I would say the second best would be the Kindle. There are a lot of people with Kindles out there, and apparently a lot of them are thinking about Medicare because we sell quite a few Kindle editions. The people buying the hardcover version and the people buying the Audible version are a special breed, and I haven't figured out yet what their motivation is, but the results are the same in any case. When you read my book, which is not a really long read, it doesn't have a lot of big, huge words in it. It doesn't have a lot of boring insurance information or government information in it, but it's a fairly short, friendly read. You're going to have a really good understanding of Medicare and why it came to be the way it is and how you can best deal with Medicare. I explain the decisions that have to be made and which of those directions is probably the best for you given a certain set of circumstances. And if that information in the book isn't enough, I encourage, welcome, and applaud anybody who wants to contact me, because in order to satisfactorily complete your introduction into Medicare and you're crossing over into the Medicare world, you're going to need some insurance to fill in the holes and gaps in Medicare. You're going to need a licensed insurance agent to help you acquire that insurance. And by yump and yiminy, I am just the guy for you. And I'm licensed everywhere. So wherever you are, I can be, at least in spirit. And with electrons, I can send you forms to sign. I can send you information. I can answer your questions. And pretty soon you will have done everything you need to do to have a long, happy life on Medicare without really ever having to think about Medicare ever again, except to know that it's there to protect you from medical expenses. And frankly, there's a guy that protects me from expenses of all kinds. His name is Randy Carson, and he's sitting right on the other side of the screen. Randy, how are you today?
I'm good. I feel particularly bright-eyed and bushy-tailed today. I've got enough caffeine in me to knock an elephant down, but that keeps me awake. Other than that, I can't function unless I have caffeine.
Well, you may remember that you had a little too much caffeine on our last recording, our last podcast episode, because we started talking about stuff and we almost burned up the whole episode talking about things that had nothing to do with Medicare, like Woodstock and Virginia, early American colonial history and things like that.
Virginia Dare. We talked about all those people.
We talked about Jimi Hendrix. We talked about
Jimi
a number
Hendrix.
of things. So
I do have one thing. We're gonna stay on track today, but I do have one thing.
Okay, this is not how we stay on track.
I have one. Away. You were talking about the Kickapoo Creek mini Woodstock.
Festival. Yeah.
Festival. Okay.
Yep.
Did you know that there was a soda back in the day called Kickapoo Joy Juice?
Yeah, I heard about that, but wasn't that in a comic strip? Wasn't that in Little Abner?
Well, no, it was actually a soda back in the Midwest. I don't know. It may not have been where you were, but it was actually a soda. And I couldn't imagine. It must have been named after that festival, because where in the world are you going to come up with a name like Kickapoo?
Well, the Kickapoo Indians probably are the ones who we can credit for, coming up with the name Kickapoo.
Okay, I get it now.
Yeah, so everything named Kickapoo probably descends from the Kickapoo tribe of Indians.
Well, I apologize. I didn't realize that was an actual Native
Don't
American
apologize.
tribe.
Don't apologize to me. Apologize to them.
I'm sorry, folks. Any of you who are a member of that nation, I apologize. I didn't realize that that was an actual official name. But anyway, I'm going to keep us on track today. I promise, Doug. Our
Yeah.
advertise after the last episode, the advertisers called me, really squeaking about the fact that we had not talked about anything other than stuff that we got off track on.
And they
But
probably threatened to withhold their hefty payments, I'm sure.
they said, if you don't get with the program, we are going to make you refund everything we've sent you.
All right, here is the book. Here is the book.
Oh my God, there it is.
And it was written by a guy named Craig, Kregg, last name Argenta, Argenta, and it's entitled When Woodstock Came to Town. And as I said, it's about the two festivals, rock festivals. One was held in downstate Illinois. The other, that's Hayworth, Illinois, and Sedalia, Missouri was the other one. And he compares and contrasts them. And it was of interest to me because I attended the one in Hayworth, Illinois, and I had cousins in Sedalia, Missouri. And so that's the name of the book. You can get it at Amazon, I suppose, and so forth and so on. And something, the clock always runs faster at the beginning when you and I are jaw jacking, because we are sneaking up on 7 minutes now.
So we are. So I'm gonna go ahead and kick it off into the actual technical side of this podcast. Everything you ever wanted to know about Medicare supplement plans. It's really easy from my perspective, Doug. Don't buy anything but Part A, Part B, and a Medicare supplement, and Part D if you need it.
Yeah, drug plan. Well, you're going to need it, because if you don't buy it now, you'll pay a lifetime late enrollment penalty. So my advice to people is always to buy that drug plan, even if you don't need it right now. And the thing is, you buy the cheapest one there is, which is going to be less than $7 in most places. And then when you need the drug plan later on, like you're starting to take some expensive prescription medications, you can switch every year at the end of the year to a different drug plan of your choice. And what I do is I help people identify the cheapest drug plan that will cover their drugs and cost them the fewest dollars out of their pockets. But that's a story for another time. I think maybe I'll do another episode on that, because people are always interested in the drug plans. And there's a certain number of my clientele that actually go to the website, the government website, and put in their drugs and put in their favorite drugstores and do the calculations themselves. So it's simple to do. And I think maybe, Randy, you and I are going to do that on one of these upcoming episodes. But today, my original plan was to talk about community health centers, and I think we will do that. It will be a longish article, but I'm not gonna read the whole thing. I am nonplussed. I'm kind of confused, because basically what we've got here is there are community health centers out there in rural or poverty-stricken areas that the federal government funds. And they give these guys a bunch of money, and the people that have these health centers set up the health centers in such a way as to offer medical care and prescription drugs, including things like, treat diabetes. What is the drug that people use for diabetes? Insulin. Thank you so much. This is a place where people in many rural areas can go to get the kinds of treatment they need without having to either go downtown or spend a lot more money. And so this article was written about just such a place in Darlington, South Carolina. So the headline is Community Health Centers' Big Profits Raise Questions About Federal Oversight. It's a brand new article, August of 2022. And it says in Darlington, South Carolina, just off the deserted town square, with its many boarded up businesses, people are lined up at the walk-up pharmacy window of Genesis Healthcare, a federally funded clinic. Now, when I think of Darlington, South Carolina, I think about the racetrack there and the fact that certain times of the year, that place is just full of NASCAR fans. But apparently
aren't the Petties based there?
Maybe so. I've never been to Darlington, so I don't know for sure. But it's a thriving NASCAR community. But apparently, the town itself isn't thriving to that extent. So, according to this article, these poor people come up to this clinic when it opens up, and the drug sales, it says, provide the bulk of the revenue for this Genesis nonprofit community health center, treating about 11,000 mostly low-income patients in 7 clinics across South Carolina. Those sales helped Genesis record a $19 million surplus on $52 million in revenue. That's a margin of 37%. That occurred in 2021. It was the 4th consecutive year the center's surpluses had topped 35%, the records show. The industry average is 5%, according to a federally funded report on the health center's financial performance. So this Genesis outfit doing 37% as opposed to 5%, the industry average, sounds like they're doing something right to me. So let's read on and find out what other people think about that. Genesis attributes its large margins to excellent management and says it needs the money to expand and modernize services while being less reliant on government funding. The center benefits financially from the use of a government drug discount program. Still, Genesis' healthy surplus stands out among nonprofit, federally qualified health centers, a linchpin in the nation's safety net for treating the poor. The federal government pumped more than $6 billion into basic funding and grants last year, into 1,375 privately run centers around the country, which provide primary care for more than 30 million low-income people, according to this article. In 2021, the American Rescue Plan Act provided an additional $6 billion over 2 years for COVID-19 care. I think we're starting to hear that a lot of that was siphoned away by fraudulent activities and by bad people. Anyway, these community health centers must take all patients regardless of their ability to pay, and in return, they receive annual government grants and high reimbursement rates from Medicaid and Medicare, higher than those offered to private physicians. Yet, an analysis found that a handful of centers recorded profit margins of 20% or more in at least 3 of the past 4 years. Health policy experts say the surpluses alone should not raise concerns if the health centers are planning to use the money for patients. But they're being attacked by a bunch of people who don't like the idea that they are making profit. There's a certain group of people out there who do not appreciate profit, private enterprise, and the motivating effect that profit has on people. So this accounting and health professor at Johns Hopkins University questioned why some centers should be making a profit margin of 20% or more over consecutive years. A center with high margin raises questions about where the surpluses go and their tax-exempt status, this guy says. The centers have to provide enough benefit to deserve their public tax exemptions, and what we are seeing here is a huge amount of profits, she said. I thought it was a guy, but now it's a she. So I think it transitioned. This person transitioned from male to female right in the middle of that paragraph. The centers must be able to answer questions about why aren't they doing more to help local communities by expanding their scope of services. Officials at the health centers defended their strong surpluses, saying the money allows them to expand services without being dependent on federal funds. And I applaud that. It helps them save for big projects, such as construction of new buildings. They pointed out that their operations are overseen by boards of directors, at least 51% of whom must be patients, ostensibly, so operations meet communities' needs. Health centers are expected to have operating reserves to be financially sustainable. This is a statement written by or uttered by Ben Money. So he's talking about the money that these centers earn, and his name is Money. There's no coincidence there, I'm sure. Senior Vice President of the National Association of Community Health Centers. Surpluses are necessary as long as health centers have plans to spend the money to help patients. And the health center says we don't take unnecessary risks. The annual federal base grant for centers makes up about 20% of their funding on the average. The grants have more than doubled over the past decade. The federal grants to the centers are provided on a competitive basis each year based on a complex formula that takes into account an area's need for services and whether the clinics provide care to specific populations, such as people who are homeless, agricultural workers, or residents of public housing. The centers also receive Medicare and Medicaid reimbursements that can be as much as twice what the federal programs pay private doctors. In addition, some health centers like Genesis, the one we've been talking about, also benefit from a 340B federal drug discount program, which allows them to buy medicines from manufacturers at deeply discounted rates. The patient's insurers typically pay the centers a higher rate, and the clinics keep the difference. Clinics can reduce the amount of out-of-pocket costs for patients, but are not required to. So the analysis, let's see here. Oh boy, I'm not seeing a lot of juicy meat in the rest of the thing. The centers defend themselves by saying we don't take unnecessary risk with corporate assets. In 2021, that center had $9 million in surplus on $36 million in revenue. More than $25 million of that revenue came from the sale of drugs. The center is building a financial cushion in case the drug program ends. Drug makers have been seeking changes in the program. So this goes on, but I believe what I've learned from this is that these centers exist to help people, and they appear to be doing a good job. I could find nothing in this article that tells me that there's any complaint about the health center's quality of service or how widespread their services are. They're serving the communities that they were expected to serve, and they're being funded to serve. What we have is a certain group of people sniping at them because these services are profitable. Now, the profits appear to me to be used for appropriate purposes, such as infrastructure improvements and expansion to new areas of service. And so I would have to say that in the absence of any serious complaints about the quality of their service to the towns that they're operating in or to the populations that they're serving, I think the sniping people, the complaints should dry up and let things proceed. Keep an eye on things, but let things proceed. We see the same sort of complaints about Medicare Advantage plans. Oh, yes, they're there as altruistic efforts to help people get excellent coverage at very reasonable cost and everything. But then we see the complaints. There's a whole ration of complaints about Medicare Advantage plans when they misserve the people who are members of their plans and who are sort of trapped there. In this case, I'm not seeing legitimate complaints about the quality of the service provided by these privately owned health plans, these clinics. So I'm going to say that keep an eye on them so that they don't succumb to the temptation to keep that grant money to themselves. Let them continue doing what they're doing. But I don't see any legitimate complaints about the reason that the people are complaining about, which is building up profit surpluses. So I applaud them. If this is all accurate reporting, then I applaud them for providing a good service to poor people and to do it at a reasonable cost and under budget. They came in apparently under budget, just like the Golden Gate Bridge took less time than they thought and was cheaper to build than they thought. And that thing is still standing and doing what it's supposed to do. One other little thing I ran across this morning, which is a little disturbing. The White House is said to plan extending the COVID health emergency. Another 3 months of special powers are incoming if the Biden administration goes ahead as reports say it will and renews the public health emergency. That just allows them to order people around. And frankly, I don't applaud the additional powers that the White House wants to grab. I'm not pleased about this at all. And finally, hot off the presses is a nice little note from Dominic Regina, one of our favorite podcast listeners. And he said, I just wanted to congratulate you on your first podcast guest appearance. I thought you did an outstanding job. And then, of course, my printer printed off the edge of the paper, so I don't know what he's talking about here. I thought you did an and then in the next line it says, talking about. Seriously, well done. I think this could be a new avenue for you and all the shareholders of MLM, and something about help with Mr. Carson. Well done. Well, thank you, Dominic. I sure do appreciate the kind words. I'm happy that you enjoyed it, and I hope the other audience members did. This is, I forget, it's like episodes 378, 379, maybe 380. 2 episodes of my interview on the podcast of Little Joe's Conservative Corner. That's Little Joe's, with an apostrophe S, Conservative Corner. And if you want to hear the 33 minutes of me pontificating and jaw-jacking like I do with Randy, then find Little Joe's Conservative Corner wherever you listen to podcasts. And people seem to think it was enjoyable. My biggest concern was the spousal unit. And after listening to it, she said that I did a fine job. I got her stamp of approval. So that was fine with me. Randy's listened to it, and he seemed to think I didn't screw it up. So I'm happy with that. So I think we brought it in under the wire today.
We did.
Better than our usual.
I can't remember. When was the last time that happened?
Oh, it's never happened before. We're sneaking up on 400 episodes, and we've established quite the reputation for blowing the schedule.
I'll tell you what, we pay for our airtime by the minute, so we just got to back off just a few minutes, and we'll be good, and we'll be under budget.
Okay, well, that's tough to do. Easy to say, tough to do.
So anyway, we need to land the plane. I need to take care of a few little wrap-up items before we sign off for today. I've got a special request. I think this is going to be a great idea. I haven't cleared this with Doug, but I think he'll be okay with this. So I normally ask you to just send Doug some mail at dbj@mlmmailbag.com, but in particular today, I would ask that you send him a question that you haven't heard us answer. I mean, we've done, like Doug said, 380 episodes, and we've covered a lot of territory, from point 1 to point 380. But there may be something that even the longtime listeners haven't heard us answer about Medicare.
You know what's going to happen, Randy? All kinds of questions about the Roanoke Island colony, Woodstock, Kickapoo Creek. We're going to get everything but Medicare.
I did limit it to Medicare questions, so we'll see how our audience see how the audience does. But in the meantime, we do absolutely have to thank you for joining us every 3 times a week we do this,
Three times a week. Yes, hard to believe.
Why, I'll tell you, that's hard to think we're up to 380 episodes. But ultimately, send Doug some mail with your favorite Medicare question that you haven't heard us answer recently. I can't imagine that there would be something we've never touched on, but if there is, Doug will give it a shot, right, Doug?
Absolutely. You better believe it.
So dbj@mlmmailbag.com. Go to Amazon, get yourself a stack of his paperbacks, the 2022 versions with the green number. They are the absolute best. What is it? 4, 5, 6, depending on the format. Yeah, dollars you will ever spend.
The most expensive is that museum piece hardcover version. I think that's $17. And I kept the price down by putting black and white instead of color illustrations in it.
Yeah. And if I had any contacts to get a hardcover version, I would have one, but I don't have any contacts.
Hey, just take a little peek in your Christmas stocking.
Well, I will. I will.
Okay.
So thanks for everybody joining us today. There's an audio version, there's a Kindle version. So get one of them because it'll be the best money you ever spent. But in the meantime, you have just spent 32 and a half minutes with Doug Jones, the anti-insurance guy, originally hailing from Oklahoma, but now residing in Cave Creek, Arizona, in his high altitude fortress of solitude. And he's also, I mentioned a couple episodes ago, working on his high altitude guide license.
Goodbye for now.